your friendly neighborhood VTS and behavior Tabitha here with a medication tip for your cats and dogs. You want to skip putting meds in their meals, which can cause a food aversion and often doesn't work after a few attempts, and instead do the 1, 2, 3 medication technique. I'm just going to reinforce my cat for coming to her station really quickly. So to start, you want to find 2 to 3 treats your animal enjoys. Then begin the 1, 2, 3 technique. You approach your animal, give treat, followed by a second treat, followed by a third treat to reinforce them eating the second treat. And the great news is, over time, your pet will come to you willingly, reducing the stress of medication time. So that first treat, you start with an approach, but then over time, they start to approach you. And then you want to gradually introduce adding different foods for the second treat. It's important to experiment with different treat consistencies and flavors. Examples are kibble, half of a mini marshmallow for a cat or a mini marshmallow for a dog, an empty capsule, or a small piece of carrot to mimic medications. So this is my cat. We've practiced this before. This is her actual medication in a capsule. So I start by giving her a dollop, followed up by the medication with the dollop. You can have it. And then I reinforce her again for eating that weird thing. So this approach isn't about deceiving your pet by hiding medications. It's about collaborating with them and establishing a positive reinforcement history where they occasionally enjoy different textures or flavors of food, but they receive reinforcement afterwards. Capsules are awesome to put medications in because it allows us to place multiple pills in one capsule at a time, but also helps to prevent the animal from tasting bitter, disgusting medications. But of course, you always want to follow up with your veterinarian to make sure that placing them in a capsule is okay. So be sure to like and follow for more cooperative care tips.